Hello, my name's Chris Roebuck. I'm the Chief Statistician at NHS Digital, and it's great to be speaking at this Open Data Saves Lives, the Unconference. I'm really pleased to be here to tell you about a group of national organisations involved in health and care data who between us hold most of the health and care data sets nationally, who've got together to coordinate and improve our open data efforts. We've started this collaboration very recently. We've met for the first time in July, so it's still very early days. So what I'm keen to do is tell you a bit about why we've got together, some of the things we're looking to achieve, and some of the feedback we've had so far, as well as hopefully giving you an opportunity to give your feedback around priorities. So we all acknowledge that open data in health and care are so important, as the Unconference title suggests, ultimately to save lives. And this can be done in a number of ways, through enabling expert users to do analysis of the data sets that can inform national policy, national decision making, find trends, patterns in the data that are really important for that. Also, similarly at a local level, patterns, organisations that seem to be doing well, getting particularly good outcomes, understanding what they're doing differently from organisations that aren't doing so well, and use that to improve local decision making. And finally, as the pandemic has shown really powerfully, putting data into the hands of citizens as well, so they can make their own decisions. And this has been nowhere more apparent than in the COVID dashboards on gov.uk produced by Public Health England that show local areas, patterns of infection in those areas to enable those decisions. So the organisations involved in this group, there's Department of Health and Social Care, NHS England and Improvement, NHSX, NHS Business Services Authority, UK Health Security Agency, along with Public Health Scotland, and there's been some fantastic work going on in Scotland that we're in England are very keen to learn from, and the Leeds Open Data Institute. As I've said, we first met in July this year, and we're really looking to do 2 or 3 things. One is look at where we can improve collectively and individually, and often this isn't about reinventing wheels, it's around learning from either the user feedback and research we've collected, which I'll say a bit more about in a minute, or learning from what's been done really well in particular organisations or in particular areas, and we've all got stuff to show and highlight, and how we can engender that collectively. So as I mentioned, the COVID dashboards have been a really good example. COVID's also driven lots of other open data sets. We in NHS Digital now routinely open up our 111 pathways data. We also open up our e-referrals data set. The NHS Business Services Authority, using a tool called CCAN, putting their data out in a very structured way now, together with the descriptive information. And NHS Scotland, Public Health Scotland, have done a huge amount of work around building a really structured open data offering, and other organisations also doing lots of good individual bits of work, and I won't list them all now, but plenty to learn from and reflect on. So what we as a group are looking to do, as I say, there's several important areas. One piece that has come through very loudly and clearly in all of the user research that we've undertaken is around consistency and predictability of our products. So having files formatted in the same way, clear metadata, clear accompanying information around quality, and all machine readable and easily findable. So the huge army of people who are using the data for the public good aren't spending their collective time tidying up their data, trying to find individual data sets, trying to track them down and each come up with their understanding of the quality of the information, but all of that is provided already by the central bodies, so you can then spend your time analysing the data, doing useful things with the data, ultimately for the benefit of patients and citizens. So that's probably one of the clearest messages, and there's a lot we can start to do as a group around how we standardise our approaches. Trust and transparency is also a very, very big theme, and that's obviously open data being transparent, but also being very clear. These aren't data that can identify people, these are fully anonymous data, and there's been strong processes applied to ensure that that is the case. There's different routes for people who want potentially identifiable data for the benefits of health and care, but a process needs to go through to ensure the security of those data, and there's various data access processes, but this is all around anonymous data. So the beauty of these data are that they can be made available to anyone. Anyone can access them and use them without the risk of identifying people. Another big theme is around building the community, and that's why I'm so delighted to present at this event. We've all done our bits of user research that we're pooling as part of this group, but keeping that community going so people can feed in so yourselves can feed in your priorities, can ask questions of us, raise challenge of us, and we're communicating in the open what we're doing, plans for future data sets for feedback, information around the quality of the data sources, and things are predictable, and our developments are in line with your needs. That full feedback loop, really important theme. And then also adaptability of the service. So while I said in terms of what's coming out and when, the formats of stuff, quality information, that's all very predictable, should all be very predictable. We as users need to respond to new demands, COVID being an example of one that's occurred recently, but I'm sure there'll be other ones, and adapting. So central to that is getting the feedback and then responding and building on what has been done with COVID for other areas, non-COVID related areas. So I hope that's given you a flavour of what we're looking to do as a group. And as I say, it's early days. We met for the first time in July. We're still prioritising our work programme, and we'll keep users updated as we do that. And also really keen to get your input as we go along. My email address is chris.roebuck@nhs.net. That's chris.roebuck, R-O-E-B-U-C-K. I'm very keen to get your feedback around any of this, or thoughts as to how we can improve our open data offer.